Assalamu alaikum. My name is Dr. Bhatti and welcome to my YouTube channel ENT Made AC. So this is the another video regarding the ear examination, and in this video we will do the examination of the facial nerve and the fistula test, which is the component of the ear examination. As we know that for the facial nerve, we are going to check the peripheral or the end branches or the terminal branches of the facial nerve: temporal, zygomatic, buccal, marginal mandibular. So it's very easy. First what you have to do is wear your headline, focus it on your patient hair face, and first you have to introduce yourself, you have to take consent, get closer to your patient. uh, मैं ना आपके जो है वो चेहरे की नस का मुआयना करूँगी। मैं जो जो आपको कहती जाऊँगी आपने वो करना है। फर्स्ट इट देयर विल बी द इंस्पेक्शन इन विच यू कैन लुक फॉर द फ्रॉनिंग ऑफ द forehead, then you can look for the drooping of the eyelid or drooping of the lower lid or the eyebrows. Then you can look for the nasolabial fold, and basically you can do inspection at rest, so that if there is a facial palsy, as you know that we have to decide that according to the house Brackman what is the grade for the classification. So definitely you have to do examination at rest to look for the facial asymmetry. As you are now, you can see that my patient has both side of the face are symmetrical to each other and there is no any such abnormality found. Then आपने क्या करना है, अपने जो है वो सामने रखना है, सर नहीं हिलाना है, ऊपर छत पे देखना है. So here I'm looking for the frowning of the forehead and I can see that on both sides frowning is present. आपने आंखें ज़ोर से बंद करनी है और मुझे खोलने नहीं देना है, ठीक है? ज़ोर से बंद कीजिए. Now I'm checking for the eye closure. अच्छा ऐसे करें, दांत दिखाएं. Now this is the marginal mandibular. अच्छा आपने क्या करना है, ऐसे करना है, ठीक है? Tap the cheek with both fingers to look for the escape of the air from the mouth. This is actually I'm checking the function of the buccinator muscle. So this is the examination of the facial nerve. It's very easy to do and it's very easy to interpret. And in your examination for the facial nerve, you should know the House-Brackman grading system, because once you get your CS1 case in short and the long case, you may find patient with the complication like the facial paralysis. Then you have to grade your patient according to the House-Brackman. Next component is fistula test. Fistula test is another very easy component of the ear examination. In fistula test, थोड़ा सा आप अपनी चेहरे से कीजिएगा प्लीज. In fistula test, what you have to do is you have to basically repeatedly press patient tragus to inward basically, and for this you have to check on the both side of the ear, and you have to ask your patient to look at your face or look at your nose, and do consult patient before doing test. You may feel dizzy or the vertigo may develop due to this test, and you have to keep your eyes open so that even I may notice the nystagmus. अच्छा मैं अब ना आपके कान के अंदर वाले हिस्से का जो है वो मुआयना करने के लिए एक टेस्ट करूँगी. उसमें करना ये है कि मैं आपके कान के जो है ये वाला हिस्सा इसको अंदर की तरफ दबाऊंगी. आपने इस टेस्ट के दौरान आंखें खुली रखनी है और हो सकता है कि आपको चक्कर आए, लेकिन आपने आंखें बंद नहीं करनी है. अगर चक्कर आएंगे तो आपने मुझे बताना है, ठीक है? दर्द तो नहीं है कहीं? ऑलवेज इंक्वायर पेन बिफोर डूइंग दिस टेस्ट, राइट? हाँ मुझे देखिए, मेरे नोज पे आप देखेंगे, ठीक है? Do not put a headlight in the patient's eye, rather put a headlight over the ear. So, but look at the patient eyes. For fistula test, one thing you need to understand, that is the concept of the third window. As we know that in our inner ear we have got two windows, a round and oval window. When there is a traveling of the sound from the external ear to middle ear to the inner ear, there will be the transmission of the sound or the pressure from the one window, and there will be the disturbed inner air fluid, and there will be the at the same time outward movement of the another window, so that there will be the propagation of the sound transmission or stimulation of the hair cell by means of that particular fluid movement. In case of the third window, what happens is when the sound is transmitted and pressure is distributed, there will be the shunting of pressure, you can say, from that particular third window, so that there will be the less admittance of the sound or the less pressure transmission, and so that patient may develop auditory and vestibular symptoms. Fistula test is basically about the third window concept, so that is the reason it is present, and most of the time it is positive in superior semicircular canal dehiscence and perineum fistula. Thank you.